Hey guys, this is Curtis Alexander. I'm a pharmacist, and in this video what we'll be talking about is the side effects that you can see from Donepezil. Donepezil also goes by the brand name Aricpet, and it's one of the more common medications that we use to treat dementia and Alzheimer's. So we're going to talk about what it does in the body, which will help you understand some of the more common side effects, which we'll talk about. And then towards the end of the video, I'm going to give you three groups of people that would want to be very careful moving forward with Donepezil. Not that they can't, but it's a warning and a precaution. Make sure you go to curtis-alexander.com as well. I have a free report of things you can do to get away from drugs and surgery as well that I use personally. So let's get into it. So Donepezil, one of the things that we see with Alzheimer's, that we see with dementia, is that there's low levels of the acetylcholine. And acetylcholine is a chemical in the brain. It's a chemical that is in large quantities in the rest of the body, but it's part of your parasympathetic nervous system, meaning it kind of calms you down. It runs your gastrointestinal tract, those sorts of things. But we also see it again in Alzheimer's and dementia. We see low levels. So the goal with Donepezil is to increase those levels. However, when you do that, you can see potential side effects. And so some of the most common we're going to see is nausea at 5 to 19%. I want to point out we have ranges on some of these because it's dose dependent. If somebody's at the lower end, chances of seeing nausea goes down. We increase the dose, it goes up. Same with diarrhea, 8 to 15%. Insomnia, we can see 2 to 14% of people. Headache, 3 to 10%. Anorexia is a big one, 3 to 8%. We'll talk about that more here in a second, as well as dizziness in 2 to 8% of people. In my personal experience dealing with people on Donepezil, these first two are the big ones that we have problems with, which also help lead to this one, which is anorexia. But most people, if they're going to have problems, it's going to be, again, the stomach side effects, because we're increasing acetylcholine, which is very involved in your GI tract. So hopefully that makes sense. Now let's talk about some of the people, these three groups of people that want to be careful with Donepezil. Okay, first one is anybody with heart issues, because we can see a vagatonic response in the heart, and what that leads to, we're talking about the vagus nerve here. So it can lead to decrease in heart rate. You can even see fainting in some people. Well, who are those people? The primary ones we're going to see them in are females, older than 65, and those with QT issues. QT, when they measure your heart, they'll do an EKG, and those peaks and valleys in your EKG, two of them are the Q and the T. Well, that interval is what they're talking about. So if you've done an EKG and you have those issues, basically anybody with a heart issue, we want to tread lightly. Okay. Next thing is weight loss. We talked up here about anorexia. While weight loss is normally regarded as a good thing, in Alzheimer's and dementia, many of these people are already frail. They already are struggling, obviously, with some of the mental things going on. So we don't want to see weight loss in a lot of these people. Now I want to point out, you can start Donepezil and then usually see the nausea resolve, go away within 1 to 3 weeks, but sometimes it doesn't. So we want to be really careful in these people that are frail, say under 120 pounds. It can be problematic because we don't want to see them lose any more weight. So if they're over 65, if they're frail, and also if they get up to that upper range on the dosage scale with the Donepezil, 10 milligrams a day, some people are over that. By the way, there's not a lot of evidence to suggest going over that is really that beneficial, but another video, another time. So that's kind of our three risk factors for the weight loss. Finally, we do have withdrawal syndromes, withdrawal symptoms that we need to be aware of. Donepezil is not a drug that you want to withdraw quickly unless you're forced into it by a serious side effect, which I have seen before, but ideally we don't want to do that. So what would happen if you withdraw quickly? You're going to see an increase in a lot of these dementia and Alzheimer's symptoms, the Alzheimer's symptoms, which is crying, insomnia, hallucinations. So we do want to be careful. You only want to do it if you have to, and if they're going to pop up, it's usually around 3 to 6 days after you pull the donepezil away. So moral of the story is stop it slowly. Obviously talk to your doctor about that. So let me know in the comments, have you or someone you know taken donepezil? What was their experience? Did they experience side effects? What were they? It's really helpful for other viewers. It's helpful for me. And speaking of helpful, I hope this video was, and I'll see you in the next one. Thanks.